Hello, everyone, and welcome to our Essential Tremor Virtual Education Forum. My name is Patrick McCartney. I am the Executive Director of the International Essential Tremor Foundation. Today, we're going to be hearing from Erin Bradshaw of the Patient Advocate Foundation. The Patient Advocate Foundation, or PAF, is a national 501c3 nonprofit organization which provides case management services and financial aid to Americans with chronic, life-threatening, and debilitating diseases. But before we get started, want to say a quick thank you to our corporate partners, including Medtronic, Sage Therapeutics, Jazz Pharmaceuticals, Cala Health, Boston Scientific, Praxis Precision Medicines, and Allevion Therapeutics. Their support allows us to provide these webinars and our podcast series. So I'd like to introduce our speaker today, Erin Bradshaw. Erin has been an integral part of the Patient Advocate Foundation's journey since 1998. With over 25 years of dedicated experience within the organization, she has played a pivotal role in shaping its growth and impact with a commitment to advancing their mission. She currently serves as the Executive Vice President for Advancement of Patient Services and Navigation and Program Development. Erin is responsible for developing relationships with new and potential donors in order to secure grants, donations, and cooperative agreements in support of PAF's case management, care line, and social needs navigation programs and initiatives vital for supporting their mission. So welcome, Erin, and thank you for joining us today.
Thank you. All right. Well, Patrick, thank you so much and welcome everyone. Thank you for joining today's webinar. I'm so excited to share with you how at Patient Advocate Foundation, we help patients and caregivers and professionals navigate the very overwhelming landscape of health care and financial challenges. So over the next 20 minutes or so, we'll be exploring what we do and how our services could be helpful to you or others that might need our assistance in the future. So let's just dive right in. So first, I just want to set the stage with, our mission and the history and why we were founded in 1996. So it really starts from a rooted personal experience of our founder, who was diagnosed with her own breast cancer. But the story isn't about her. It's about a very dear friend who, through her challenge of late-stage cancer and the navigations that she had to face through the financial and bureaucracies that resulted in challenges to getting to the access to the treatment that she needed, is the whole basis of why Patient Advocate Foundation exists today. So if we take ourselves back nearly 30 years ago, there weren't a lot of protections and policies in play or standardization around health insurance denials and appeals. There wasn't sources like GoFundMe. And so oftentimes people would find themselves potentially not in any kind of solution or capability to get towards the treatment that was prescribed for them. So with that being said, Patient Advocate Foundation, our core is about helping people meet them where they're at when they need help around case management services or financial aid that are connected to their critical or chronic life illness. And so during this presentation, I'm going to go ahead and share a lot more about the 3 direct patient services that we offer, in addition to some complementary and added assets that have been born from what all of the patients are telling us as we continue to help them navigate these administrative hurdles. So we have a lot of impressive stats, but what I care about is the 185,000 patients we've served in 2023. These are people that we have physically connected and supported, whether it was through our copay relief, our financial aid, or through our case management services. And you'll notice that we've provided a lot of financial contributions back to people. But one of the areas that I will call out is the 18 million of debt relief on behalf of the patients we've served through case management. So we actually don't have direct financial assistance in case management. So our role is different, and we are helping you uncover and connect to resources that help alleviate some of those financial pressures. They could be overturning an appeal, applying for charitable assistance, enrolling into some federal or state benefits, etc. So Case management is the core and the reason why Patient Advocate Foundation was funded. And as I shared earlier, we've also learned and heard from those that we are serving needs that have resulted in additional support. And we're really the purpose of us developing and designing other core areas of support that align naturally well within the scope and the mission of the organization. So today I'm going to speak a lot about case management, copay relief, financial aid fund, and our patient education. But I do want to just call out that we have a strong commitment to health equity, and we see firsthand the access and ability to fight and get access to the care that they need, and reaching to certain audiences that may not have the same support systems or accessibility that others might. So with that, we also are learning and trying to move into the communities, and we partner a lot with other community-based organizations and want to make awareness of our services so that if you or someone that you know needs our help, that you can navigate them to us. So in addition, we have a special event, and so I'll just call out that we do have academic scholarships for someone who's been impacted by a diagnosis that may have been interruptive or in their inability to supply savings towards a college education. So annually, we support about 40 students each year, and we have a Promise of Hope, which is our special event, which is our annual gala where we raise money for those things. In addition, we measure and report our impact, and we have a full health service team where through our Patient Insight Institute, it's really the umbrella that captures the body of the work and helps us portray these things through different mechanisms like posters or white papers and areas that we can take the lessons and of what we're doing one person at a time and apply them to hopefully move change for the masses. So I'll dive into case management. So our mantra has always been the same. So for almost 30 years, we want to provide help to the people that are in need of us. So we're on the front lines, providing a wide range of access and affordability issues. We want to make sure that you are taking care of yourself, and we can take away some of those practical and emotional burdens. So case management is a one-on-one intervention support. It's the part of the organization. It is where we are extending or connecting people to safety nets to overcome and improve healthcare access, such as health insurance navigation, disability navigation, and support for financial hardships. So as I move through this presentation, I'll also give some examples of what we mean by that, but you'll see in the bulleted points below a very summarization of what those might look like. And our goal is to really help people do and act on behalf of what your needs are. For example, maybe you're in a medical crisis situation and it's impacted your ability or has stopped your prescribed treatment. And your case manager is there to actively identify and locate resources such as charity care or manufacturer patient assistance programs and other resources that can help reduce that financial burden and make sure that you're getting to the treatment you need. We also help with paperwork, application processes. We can reach out to providers in order to negotiate debt solutions, look at payment deadlines or extending or even payment plans, and help secure discounts or write-offs when it is possible. So that's one example of how we navigate that for you. So our eligibility is pretty broad. It really, if you have a chronic life-threatening debilitating diagnosis, you must be a U.S. citizen or permanent resident actively receiving treatment in the U.S. or a territory, and your need is reflective to health insurance, disability, or financial hardship, so the core competencies that case management offers. You'll note here that it's any insurance status, age, gender, income, location, and so we offer services to a broad range of different diseases and diagnoses too. So last year alone, we served almost 1,000 different diseases, because the core area of support is around kind of those navigational elements. And we recognize that as not a disease-specific organization, we want to help with those areas. So there is a QR code here. If you wanted to scan that quickly, you go to our website, and it'll bring you even deeper into more details there and how to request for help. but you can also call 1-800-532-5274. That's our national hotline. And our website is patientadvocate.org. So I want to explain a little bit about how it works. So we support our callers through a telephone service. We do use technology like email and things of that nature, but all of our work is done telephonically. When you call us, we will do a needs assessment. So upon your contact, it's a very comprehensive intake that's going to ask some demographics and get a little more details on where your stressors and practical needs are so that we can enter a case for you that then gets assigned to a case manager. And within 2 business days, they will follow up with you, and they will follow up a minimum of 3 times if we're unable to reach you to make sure that we connect when it's best for you. We work collaboratively with you, your family, the caregivers, and any kind of stakeholder. And our approach is about creating a plan of action that finds the right resources for your unique situation. And then your case manager becomes your collaborator and advocates on your behalf for the areas that we serve. This is a visual demonstration of what I mean. So when we have a lack of insurance, so maybe you don't have insurance, or you're underinsured, or your difficulty because of the high out-of-pocket requirements that you have, maybe there's just a lack of understanding of how your benefits are designed and listed. And that's a very common thing because the area of health insurance is very complex. We also help with patients receiving healthcare from multiple providers, and there's costs associated to each. And we understand that medical debt mounts very quickly and at the very time when their ability to pay is the hardest. So we want to make sure that we also understand the employment protections and workplace entitlements that you might be eligible for. So commonly, insurance benefits are tied to employers. And so are the income replacements, maybe short-term or long-term disability. And if you are navigating a treatment, you may be in jeopardy of not being able to fulfill your work obligations, whether temporary or maybe on a long term. So those are areas that we are very familiar and help support as well, as in addition to some protections that are out there like family medical leave or ADA accommodations and COBRA benefits if you were to move into an area where you can no longer work. And then cost of living. When people become ill or you're faced with a chronic disease, incomes are almost always impacted by our experience. And many patients have a difficult time sustaining their basic needs like housing and transportation. And sometimes these are temporary as we look at longer term solution benefits, like I mentioned earlier, around employment or disability protection. And lastly, all of these issues really impact the emotional distress of the person we're serving. So our goal here is to really take away that burden so that we do the work and understand what it is, make the calls, coordinate with you, and hopefully remove some of those distresses that you're facing. I just want to share this as a point of reference. So I mentioned earlier that we have some research, and this was a study that we just conducted about the administrative burden, and is really representative of why case management still continues to be a really needed resource for many. And so when we were reaching out to people that we've served, it's astonishing, but 64% have reported experiencing an administrative burden in the past 12 months. And 55% of them spent time on health insurance administrative tasks. And so for you on the call, this might sound similar or familiar. You might be trying to get an authorization for a particular treatment. Maybe you're trying to understand what cost was associated. There might be a coding and billing area, but you can see here that 20% of their reported time was on safety net non-medical application. So it really just reinforces the needs of our services, not only by Patient Advocate Foundation, but others in the navigation and advocacy space. So now I'm going to move to financial assistance and share with you the other 2 direct patient service programs that offer direct financial aid. We have a financial aid fund. I will share with you that this is small grants, and it's intended to be non-medical support in nature. So for instance, housing, lodging, meals, transportation, things that are not covered by insurance and cost of living expenses like utilities or rent and mortgage. The eligibility and what financial aid funds are open are actually on our website as well. So patientadvocate.org/financial aid. There are some funds are eligible for patients directly, and then the caregivers can support them too. But you'll see here grant eligibility is first come, first serve. It's until they're depleted. The grant amounts do vary, so they can range from $300 to $4,500, and they're issued via check or an electric transfer. What we do to ensure eligibility is we do confirm that the diagnosis aligns with the particular financial aid fund criteria, and incomes will be publicly posted, but they are between a 4 and 300% of federal poverty level, and we do adjust for the cost of living index and household residency. So for someone who lives in a more costly area like New York, there might be a different variation of what that income is versus someone who might live in a more rural space. They also have to be a resident, and a physician has to confirm the diagnosis to determine eligibility. We have authorized representatives that are available from 8:30 to 5 Eastern Standard Time, Monday through Friday. And then there are availability to apply online through our online portal at the patientadvocate.org/financial aid landing page. And every 12 months, rolling 12 months, if there additional needs are there, you can reapply if the grant is available. So now I'm going to move to copay relief. Copay relief is now 20 years old. This was born out of what we heard in case management, and we saw the shift with health insurance and the cost burden falling to the patients themselves. And to date, we've served over 736,000 people and allocated over $2.14 billion in patient assistance. Program eligibility has some similar features like the financial aid fund. The household income is up to 500% of federal poverty level, including that COLI index I mentioned earlier. There's a verification of diagnosis. In this particular program, the person must be insured and have pharmaceutical coverage in order to be eligible, along with meeting the income and the diagnosis eligibility. It helps provide assistance for prescribed therapeutic medications, including generics, charges related to the administration of medicine and office visits of that day, and can also provide support medications that are prescribed in addition to the therapeutic treatment. You will see, I recommend that you go to copays.org for all eligibility and available funding. And I check back routinely because these can change depending on our ability to bring in support and find the financial resources to the ever-growing funds that we offer. There's also some that will offer premium assistance, and I like to call that out. You will see on the eligibility aspect of it, it will identify which type of insurance and whether premium is available along with deductible, copays, or co-insurance. So this is how it works. There's an online secure portal, so a patient, a provider, or a pharmacy can actually apply on behalf of the individual, and they're available 24/7. There's an electronic signature capability and document upload and fax importing. We also have personalized assistance through our copay relief team at 866-512-3861. What's unique about our services with this is that they have instant eligibility determination. So an applicant actually can get an immediate decision based on their submission. There are small areas where that might not be the case and additional documentation is needed, but that will be shared and it will be known at the time of application. The electronic income verification allows us to also do that. And so we have a 95% of all applicants were able to validate that their income falls within the range. And we have, on behalf of making sure to the administrative hurdle that we talked about before, we are trying to figure out means and ways to operationalize and support those that are needing to help navigate these systems. And so we try to cut back the processing and all those steps and make things very simplistic in this way. So all applicants will have a complete income review, and all patients in diagnosis and insurance are going to be verified in order to be eligible for the financial assistance. These are just some expenditures or claim submission types virtual pharmacy cards. You might be familiar with those, like if you were to go to a manufacturer copay program and they have like a virtual card. Also, there's that portal we talked about where they can submit through that on behalf, or there's mail-in fax, and of course, there's always the check EFT. So this is the same 12-month rolling period for applicants. There is a look back period for someone who has applied for 6 months. So maybe we apply today, but you had some expenses that date back. You're eligible to submit for those. There's also a grace period of 2 months at the end of the award. The awards are 12 months and equal to a particular dollar amount. And there's a 120-day utilization requirement. So in order to keep the claim active, we do want to see utilization with 120 days to be considered. Otherwise, it would be closed. That funding is then repurposed to provide support to another patient. There's lots of feedback and communication loops so that you know that there's there. So those are the 3 direct patient service programs. And what I'm going to share with you is more of the self advocacy tools that we've created in addition through our patient education and communication. So patient education has always been a core of what we do, and we use these tools very frequently within the work that we do in case management to help really empower and create knowledge growth around very complex issues. We do a lot of our work through conference calling, so by demonstrating and leading through that. But in addition, we house lots of different educational collateral through different means through our education section on our website. So patientadvocate.org/education is our landing page. It is an education resource library that houses tip sheets, webinar trainings, booklets, oh my goodness, so many different areas of support, because we understand that sometimes these topics are very new and may not be something that you've experienced before. And they are very core to what we hear from our audience. So you will see things around health insurance, what to do during open enrollment, what if I am aging off a parent's plan, what to expect if I am going to be moving from an abled body to a disabled body, navigating the disability process, navigating the health insurance process, how to negotiate your medical debt, etc. Like very, very tangible, key deliverable action steps to aid you through those elements. We have 61 educational resources that we've created just in 2023 and 9 in Spanish. We also have translated a majority of our website into Spanish. And we continue to grow those assets. The newest publication I'll call out is our Medicare Resource Center, which is a landing page for those that are on Medicare, whether it is for disability or for age, and houses a lot of the newest details around the Reduction Act of 2022 and what it has on Medicare coverage, in addition to just the basics of I'm now enrolling into Medicare. What do I do next? What is the difference between a Medicare traditional plan, an Advantage plan, a supplemental plan, all of those areas that are so critically important as you're making your decision. One resource I will encourage you to use is our customized tool called the National Financial Resource Directory, where you enter your diagnosis, the state you reside, and areas of needs. And it produces a complete list of programs that map to you, and then gives you a small amount of detail, gives you links to connect them, and hopefully guide you to a solution or a resource that might be beneficial to you. Our team uses this. This is something that we designed over 20 years ago, and it has been manned by a person who actually daily enters and connects and updates these resources. They also will connect you to our educational library as a complement to something that we think might be additional to an actual organization external to PAF that might be beneficial, and other search engines. We've had over 4 million match of resources provided to users. We've had a significant increase in utilization over the past year. And we are here as a QR code as well which will provide a video demonstration on how the product works. And lastly, communications. We are always sharing resources, not only of our own, but also of others. And we encourage you to sign up for our email listserv. We will give you announcements and notices of new copay programs that are available, to case management programs, to new educational collateral, and even a lot of external assets that we have come across that we find are very beneficial to you. For instance, Social Security is undergoing some changes, and so they have been very public in announcing that, and we want to make sure that you also have that information, and as well as some of our other nonprofit partners, and really looking at how can we be comprehensive. So we don't want to provide anything that you don't see of value. So we are very intentional around our messaging. So again, if you would like to do that, you can actually sign up on our website, which is patientadvocate.org, and get those details. So with that, I just want to thank everyone for the opportunity to give a high-level view of Patient Advocate Foundation. I do encourage you to go to our website, as you can see on the slide, patientadvocate.org, our Spanish site listed as well, or call us directly if you see some need and we can be of benefit to you.
Wow, Erin, thank you so much for sharing all that information. You guys are a great resource. I was excited when I met Richard at the American Academy of Neurology and learned about your organization, because we weren't aware of it. And, so we're really excited. Thank you for sharing that with us today. We hope everyone found this presentation to be very helpful and informative, and hopefully you learned something new today. If you have any questions regarding essential tremor, we encourage you to visit the IETF website at essentialtremor.org, where we also have a link on our website to the Patient Advocate Foundation, so you can get to them through our website also. If you don't have access to a computer, you can also call us toll free at 888-387-3667. And finally, if you are a donor to the IETF, we thank you for your support. And if you aren't currently a donor, we hope you consider a gift that'll help us to continue to do the work we do, promoting ET awareness, education, support, and research. So we're going to be hosting and have hosted a variety of virtual ET education events, and have some more coming in the upcoming months. So look for notices about these events in your Tremogram e-newsletter, on our social media, and in our Tremor Talk magazine. So Erin, thank you again for joining us today, and thank you all for listening, and we hope you all have a great day.